Are these changes just to cut costs?
Why are you putting A&E into one town?
How is all this going to be staffed? You don't have enough doctors and nurses as it is.
Haven't you already made your minds up?
The current proposal that we are dealing with in Greater Huddersfield is to look at the two hospitals in Huddersfield and in Calderdale to try and see how we can change the way that services are operating from the two hospitals. Over the last 15 years while I've been a GP, I've noticed that patients are living longer, and they are living longer with what we call long-term conditions. And our hospitals have noticed increasing strain over the last few years as patients come through the doors requiring more specialist care. And therefore, we had to sit down with our consultant colleagues. We have looked at the national standards which are expected of all hospitals, and these are quite difficult to attain, and they're certainly very difficult when we're trying to run services on two sites like we are at the moment. It's become apparent with the current staffing issues and financial issues that it would be much better if we could get a lot of these services provided on a single site. By putting services together into one hospital, we can ensure that we do meet these national standards, and therefore the population of both Huddersfield and Calderdale will have the best care available 24 hours a day, 7 days a week. This will attract even more specialists into our area who will want to work at a specialist hospital, and this very much future-proofs healthcare for both populations. There are many, many benefits, but I think the best one really will be the urgent care and the emergency care. For patients that are really sick, who get taken to hospital by an ambulance, they will be seen quickly by consultants. They will have access to surgeons, to obstetricians, to paediatricians. They will all be there in the same hospital. There will be specialist services available 24 hours a day, which are not available at the moment. This is not about saving money. These changes are about quality of care. We started this work 2 years ago when money wasn't particularly a consideration. Our concerns at the time were the fact that our hospitals were starting to struggle to keep up with national standards of care. However, we can't deny that times have got harder from a financial point of view, and as we are going to, in effect, have to borrow money to invest in our hospitals, we have to do this in the most cost-effective way. We're really pleased to be out in public consultation now. This is our chance to talk to the public about the proposals and also listen to their concerns and try to address those. We are really keen that the public in Calderdale and Huddersfield get their chance to have their say. So we're encouraging them to fill in our survey. They will be able to find these online at the Right Care, Right Time, Right Place website, but also in their local GP, in community centres, in the hospital, and also on the Greater Huddersfield and Calderdale CCG websites.